People often want to focus on the fraud side of that, right? But it really is a fraud, waste, and abuse issue. And when you drill it down to its essence, it's an overpayment issue. And as a system, we are overpaying for healthcare in many cases, and that shows up as fraudulent activity, wasteful or abusive billing. And why is it an issue now? Healthcare is a $4 trillion market in the United States. It's a lot of money. It's the biggest segment of our economy, single segment of our economy, and we're all dependent upon it. And costs just keep escalating. And it's estimated that fraud, waste, and abuse is probably somewhere between, on the low end, $250 billion a year. On the high end, estimates as much as $800 billion. And so if we can eliminate that overpayment dynamic and out of the system, then that makes healthcare more accessible to people. It reduces the cost to companies, to taxpayers, to individuals who are seeking healthcare. The short answer is everybody ends up paying more. But let's break that down. And when you really look at who pays for healthcare in the United States, largely it's employers pay for healthcare for their employees as a benefit, or government entities like Medicare, Medicaid pay for healthcare. So who gets hurt by this fraudulent, wasteful, and abusive activity? Employers get hurt because their costs are going up every year, but also the employees. Their co-payments go up. Their percent of healthcare they have to pay for as well goes up. Taxpayers who pay for Medicare and Medicaid, they get hurt. Government budgets. But there's a segment of the market that we don't think about often as getting hurt. And the people that get hurt often are the actual healthcare providers who are providing good healthcare at a good value every day to their patients. And they get hurt because as costs skyrocket from fraudulent, wasteful, and abusive activity, then insurers or payers of healthcare look to control cost, and oftentimes it's the good providers that are getting compressed as you try to control costs across the board. So frankly, good quality healthcare providers should be the biggest cheerleaders for efforts to stop fraud, waste, and abuse.